The mosquito has been the cause of the spread of many diseases throughout history and the world. The Zika virus, carried by mosquitoes, has recently become a public health emergency worldwide. Dr. Daniel Gluckstein, an infectious disease specialist at Pomona Valley Hospital Medical Center, stresses that prevention is key, as there is no treatment or vaccine yet for Zika.
So the Zika virus is a virus that was discovered initially in 1947 in Uganda, where it was found to infect monkeys, and we've discovered in the last several decades it has spread to other areas of the world, initially mainly in Asia and the South Pacific, and then what has happened dramatically in about the last year and a half is the emergence of the disease initially in Brazil and now throughout much of South America, Central America, and the Caribbean. At this point, we know the disease is transmitted by certain species of mosquito that can feed both during the day as well as night, and these mosquitoes tend to be closely associated with human habitation, particularly in settings where people do not have air conditioning and do not have adequate windows or screens on their buildings where they live.
The most serious consequence of the Zika virus is the risk for a serious birth defect.
So the big concern with Zika virus is it's now clearly demonstrated that it can cause very serious damage to the developing brain of the baby in the uterus, particularly during the first several months of pregnancy, where it seems to directly damage brain development and then can lead to very serious problems with brain and mental function of babies as well. It clearly contributes to stillbirths, death of the fetus at a young age in women.
For most people who contract the Zika virus, symptoms are mild.
For most people who get Zika virus, they may have a mild fever, usually a bit of a blotchy reddish rash, and not a whole lot else. Sometimes some red eyes, sometimes some swollen glands, and usually the disease lasts about 5 to 7 days. They may have some joint pains as well, and then they get better, and it is of no serious consequence to their health long term.
Dr. Gluckstein gives advice on reducing your risk of getting the Zika virus.
The particular strains of mosquitoes exist mostly throughout the tropical areas of the world, and to some degree they are present within particularly the southeast United States. Avoiding mosquitoes is the #1 way of preventing Zika virus by having adequate protection in homes as well. It's quite clear that air conditioning reduces the likelihood that somebody will have mosquitoes, reduces the risk that the mosquitoes will actually bite people, and also reduces the risk that the mosquitoes will carry the Zika virus.